As I come into the room, first thing I'm going to do is perform my hand hygiene. Then I'm going to introduce myself to the patient. Hi, my name is Benjamin. I'm going to be doing a Foley insertion on you today. Then I'm going to have my patient confirm their name and date of birth against what's on the wristband. I've already got my curtains closed, so we're providing patient privacy. Now I'm going to go ahead and move into my care. And the first thing that I'm going to do is I'm going to place this waterproof pad underneath the patient's thighs. And then I'm going to put on a pair of clean gloves. Obviously, I wouldn't actually have the clean gloves in my pocket in the real world, but we're just going to pretend.
Yeah, but the only thing is when you do the catheter, your tooth is about 3 or 4 inches in. You're over here. You can just say that and just you want to redo it.
Okay, now I'm going to start my first round of peri care. So we're going to pretend like that's filled with soapy water. Then we're going to clean around the meatus and down, then use a different corner of the washcloth to the other side, and like such. Then we're going to discard that, trash can, not floor, depending on the day. Then I'm going to take my other towel, and I'm going to get them all dried off. Now I can discard these gloves. I'm going to perform hand hygiene again. Now I'm going to get ready to get my catheter kit set up. I'm going to take the outside bag and fold it inside out, sort of lift it, so that I can use it as a sort of trash receptacle. And I'm going to open my kit using sterile technique. In the real world, my gloves would be inside the kit, but I wear a large and the kit comes with mediums. So the first thing I would do is put on my sterile gloves.
Right here. No, we did. I don't know what we did.
Discard that. I broke steel already by reaching over my sterile equipment. And move on. At this point, I'll ask my patient if they have any allergies to latex or iodine. For this scenario, we're going to say our patient does have an allergy to iodine. So we're going to discard our iodine solution. First thing that I'm going to do is I'm going to take the waterproof pad. And I'm going to open it up using the 3-finger technique and put it shiny side down in between my patient's thighs.
I'm just setting my stuff down.
Then next, my sterile field is going to go, again, shiny side down, lower in between my patient's legs. I'll move my catheter kit over to my working area. Then the next thing I'm going to do is I'm going to perform my second round of peri care. I'm going to put my hydrogen peroxide in this, I'm going to pour it over the cotton balls. And then with my non-dominant hand, if this patient was uncircumcised, I'm going to retract the foreskin. Then I'm going to hold up the penis and just swipe down using each cotton ball only once. Clean around the ears, down, around, down, around, down, around. And I can discard my tweezers as well at this point. I did this in my female video too. I forgot to hook up my syringe with sterile water for the balloon inflation before I unsterilized my hand. So now I get to struggle with this. So now that I've got my syringe secured in the balloon port, I can pick up my catheter with this hand, and I'm going to tell my patient to take a deep breath and bear down like they're having a bowel movement, and then insert the catheter. Wait, no. First, I'm going to put the lubricating jelly into the tray, then lubricate the first 1 to 2 inches of my catheter. Then I'm going to begin my insertion. I let my patient know that this part might be a little uncomfortable. And then, if I meet any slight resistance, just twist the catheter a little bit. Okay. Then, now that my catheter is all the way in, I can take this hand, and I would inflate the balloon at this point, but we've been having issues with it popping out and spilling sterile water everywhere. So I'm not actually going to inflate it today. And at that point, I can now take this hand off. Since I'm not inserting anything else, I can do whatever I want with my hands. At this point, I would take my tubing, and I would secure my sit-up to my patient's thigh. And I would also tug lightly on the catheter to make sure that the balloon is in place, and that my balloon is indeed in the bladder. I'm going to secure this to my patient's thigh with a thigh strap, which we don't have today. And go underneath the bed and hook my bag onto the bed. At this point, I can doff my sterile gloves.
One goes further down.
And perform hand hygiene.
So then you take that and you place it on here.
And at this point, I perform another round of peri-care, get my patient all cleaned up, get all my supplies out of the way. Obviously, put them in a very clean glove before that. Ask my patient if there's anything else they need, and that's that done.